All right. Welcome, everyone. My name is Sarah McAllister. I am the Senior Associate Director here in the Office of Alumni Career and Professional Development. And we are so glad that you're here today. Quick reminder, just put themselves on mute. I'm going to go ahead and do that for everybody. So thank you. So this session is being recorded and will be uploaded to our YouTube channel. Nina Raffo, who is our Assistant Director, she will be putting the link in the chat later. And if you have any technical issues, please feel free to direct message her. Thanks again for just introducing yourselves in the chat. We love to see where everybody is joining from. Okay, with this, we're going to dive right in. I'm going to first thank Noah Madison for being here, for giving of your time today. I know that this is a topic that I think we can all relate to and are curious about. Noah is one of our best volunteers across different genres for the Alumni Affairs Office. And so I'm not going to go into his bio, but I would love for Noah for you to introduce yourself and however you would like to introduce yourself, and then take us away from here. So thanks again, Noah.
Anytime, Sarah. So good morning or afternoon, everyone, depending on where you are in the nation. So yes, Noah Madison. I'm a partner with Teamworks Health here in Denver. Myself and my partner, we're a boutique executive search firm focusing specifically in healthcare and life sciences, working mainly with private equity-backed orgs as they scale on their operations side. And so just to dive right into things, I think. So I did one of these a couple of years ago, I think. And so I was looking back at my old deck, and this was actually the first slide on the old deck. And it actually really is really relevant, resonates today just as much as it did a couple of years ago. It seems that, we're getting better at this, but, it used to be just payers and providers. So the insurance companies and then, the big hospital organizations, such as HCA, the biggest one. But, and what we'll get into talking about a bit more is that there's many more smaller players, especially private equity backed players that are getting much larger, moving forward faster, because they're not the Titanics of the old generation. There we go. A lot of this research comes from PwC. If you're not familiar, if you're looking for great healthcare information year by year, PwC, McKesson, and the like, all put out some form of trends, what to look for in the following year, towards the end of the year. So I definitely looked into that. But as you can see, there's going to be a $1 trillion shift in the next 5 years. And that's with our healthcare spend being 4.3 trillion in 2021, which was 18+% of our GDP, which is way too high. Definitely the highest across the world as far as healthcare spend. Let's see. Big piece for this is as it says, embracing these new roles. Orchestrators, integrators, and platform and solution players are big. And the more that we talk about things, the orchestrators and I think the platform solution players are the big ones. Integrators are great too, but focusing on this seamless delivery and the humane experiences for patients is key in a lot of different ways. And then of course the platform and solution players are the ones that are creating the tech to help a lot of this change, not only delivering this seamless experience, but focusing on a lot of other areas that need change, upgrading. So the main areas that we're discussing, as I mentioned, when I did this a couple of years ago, it was a lot about telemedicine, and that was, because coming out of the pandemic, obviously there was a huge jump in that. This is really, as you can see, it's really defining the different areas within the whole ecosystem. And so we will talk about that. Okay, as far as affordability, a big piece of this is managing the staffing demand. There's a lot of different ways of doing that. A friend of mine in a healthcare incubator startup building that I was in at a point in Denver, she actually is developing a software to manage nursing staff based on patient flows. But that kind of stuff is really important. That the health equity piece is definitely important. Maintaining, health equity, basically maintaining the highest level of health for all, is really big as far as value-based care and population health and everything else to drive down, as you can see there, the value-based care to help drive down costs for all. What else? An example of, a good example of this is payers that are buying. So, the insurance companies that are buying wellness products, wellness companies to make their populations healthier, so they don't have to pay as much in out-of-pocket costs for procedures that could have potentially been averted if the person would have just been more healthier. Digitizing healthcare is extremely important. The main thing here is this, one of the main things here is this interoperability across the ecosystem. I mean, the EHRs have been talking about electronic health records companies such as Epic and Cerner, which are the big two across the nation. They've been talking interoperability for a long time, but so that information can be shared across healthcare providers for individual patients is really important for everybody involved. As you can see there, the stakeholders, members, clinicians, et cetera. Let's see here. Another thing that's really important here with the digitizing is is this remote monitoring and health in digitizing is an important driving force to drive down overall costs. I mean, as you can see here too, AI, I mean, that's obviously the big catchword these days, but it really is very important. I read something today about how AI, and this is AI in general, but it was talking about how San Francisco is getting populated again with tech people. They all ran away to Oregon or whatever, to the woods of Oregon, but now they're all coming back. And a big piece of that is that 10.7 billion was invested in the first quarter in AI. It didn't say how much of that was healthcare related, but 10.7 billion in the first 3 months of the year obviously is a lot of money. As far as attracting and retaining customers, really big piece here. I mean, 10,000 people a day are aging into Medicare. And the underlying thought of that is, I mean, just as people get older, they get sicker. As they get sicker, they need more services and all of that. But so, really thinking about the patient experience is what's important, because it's like any other sort of consumer driven business. If a customer doesn't like the way that you're doing business, they're going to move on to the next provider of that business and work with them instead. If you look at the third bullet there, a couple of apps / portals that are helping with this. A big one is easy access, which is through Athena. And I mean, it has stuff to keep things seamless. For example, appointment reminders, easy pay portals, telemedicine, and more. just more about attracting, entertaining customers. You know, big thing and things that we hear from the from some private equity people that we work with. I mean, obviously, they're going to invest in the businesses that are going to make them the most money. So they're always talking about things like reimbursements for different types of procedures and, for telemedicine, stuff like that. I mean, that's a pretty easy one. As government, makes things easier for people to get paid, the people that have the money are going to, dump more money into it to make more money. And then also, as you can see, the VBC, the value-based care, just keeps on coming up. And we'll talk a little bit more about that in a minute. Okay, so obviously, if we're talking about digitizing health, the healthcare ecosystem, minimizing risk and always think about risk is a big issue. As you can see, 63% of healthcare leaders say they're very concerned about cyber attacks, as well they should be. In 2022, there were 707 publicly disclosed data breaches in the healthcare world. It's some people have put it where your financial, getting hacked for your financial information is one thing, but getting hacked for your healthcare information is a much bigger deal. Kind of depends on how you look at it, but your healthcare data getting hacked can be very expensive too. Let's see here. As far as workforce shortages, I mean, this is a big one, and it's on the news, all the time. I have plenty of friends that are nurses, and they, of course, they talk about this. It says there, 94% of nurses say severe or moderate shortages, across the board, and half are severe of that. I've read a stat where there needs to be a hire of 200,000 nurses a year to try to keep up with demand. And that's, obviously not a good thing. As you can see, physician burnout and aging out are a big problem as well. I mean, almost 125,000 short of what we're going to actually need as far as physicians by 2033 is not really a good thing. Obviously, people are thinking about fixes for this, and it definitely a part of this fix is, utilizing tech and automation to take some of this out of the hands of clinicians. And a big thing that I hear a lot from clinicians too is the amount of time that they spend on paperwork. And there's actually plenty of AI automation tools now that they sit on your desk like an Alexa, and basically take all of the information within a consult and put it into the system. Also use all of the right codes, so that reimbursement codes and all that kind of stuff. So that's definitely being addressed, and that's helpful. I mean, something that I heard too was, a clinician friend of mine was saying just how much time they spend at home after they get out of the hospital that they have to spend on documentation. So that's, obviously a big problem. Here's some other stuff about that. As I said, it's a big problem. Interesting thing, as far as delivering care in something, say with nurses or clinicians, where changing the mix up of how they work. As far as upskilling staff, in giving those on-site nurses and clinicians more money, and then allowing people that want to have a hybrid work situation, being able to work from home, allowing some of your staff to do that, seems like a pretty good step in the right direction to me. Yeah, so telehealth is as I mentioned in my last kind of report, I updated these numbers. But as you can see, I mean, telehealth is going to be a big fix for a lot of things, that you can do, that can be done from home instead of utilizing resources, manpower and just, brick and mortar. Brick and mortar to do work can be done from home. Let's see here. This focus on consumer centricity, I think, is really important. Once again, this goes back to retaining your population, your customers, where it really always has kind of been set through the people that are either paying for it, the policymakers or the clinicians, how they want the business done is what it's always really been thought about. But switching it over to what does the consumer want, is really going to help in the this seamless process. But in the same sense, I mean, especially clinicians, you need to be speaking with those folks about what makes the process better for everyone involved. So it's really a collaborative type thing that needs to happen, and it is happening. It just needs to keep on happening. Let's see. So once again, this kind of came from my last presentation, but going through the different areas, these are all still areas that should be thought about. And if you're curious, definitely look into them more. But as I mentioned earlier, I mean, our healthcare spend in 2021 was 4.3 trillion, and over 18% on GDP. That's a sad number to show how expensive it is to get healthcare in the United States. This value-based care versus fee-for-service. If you're not familiar with value-based care in our world, basically, the more value that you provide within the care, the better your reimbursement rates as a provider, which makes a lot of sense because it's, if you look at it in another area of the insurance market, as far as all of the natural disasters that we've had and the hurricanes and all that kind of stuff, everybody's insurance goes up across the board for paying for other people's stuff. So if we can, bring down the amount that is paid in healthcare, then everybody pays less in healthcare. Data analytics are actually obviously a huge thing. Every private equity group we work with now, it's pretty much expected for anything VP level up that on the operations side that the person has a at least somewhat of an understanding of big data, and how to utilize that to make decisions. And then especially from a strategic, from an FP&A sort of job, that's a big deal. We've talked about telehealth and telemedicine. Obviously, behavioral health. I mean, I'd be remiss not to talk a little bit about behavioral health. Obviously, there's a crisis right now, but it's by far where the money's really being put because, there's some, out of the bad things of the pandemic, the good things that came out of the pandemic, for example, the less stigma of people's mental health and wellness, and people being able to talk about it and wanting to get more help for it. Is a really good thing, and mental health leads to better overall health, and vice versa with that too. Fitness and wellness is important. 3D printers are an interesting thing. We're not quite there as far as being able to print donor or print organs, but something like 107,000 people are on waiting lists every day for different types of organs. And then I think something like 17 of them die every day waiting for new organs. So if we could, if we'd have the ability to, which we will have the ability to take that person's own cells, print them a new organ, and there's going to be, much less chance of rejection and all that kind of stuff, because it's actually going to be their own cells. That's a very interesting thing. And, for those waiting for organs, I mean, I'm sure they're very hopeful about that. AI, once again, just some areas as far as where AI can, come and, can make things better in treatment, in the care process. Diagnostics and patient results. Diagnostics and patients results are really important. I can't remember any stats on it, but, people that misdiagnosis is a big problem. And so if we can use AI to, drill things down and give clinicians, better results to make better diagnosis, that's really going to help in the whole situation of, this value-based care. And then, assisted living, senior living, home care goes back to the 10,000 people a day going to Medicare, just the baby boomer generation getting older. Home care and hospice, they were private equity kind of has a, every year they have a couple few hot areas that they want to get into, and home care and hospice just keep on lasting. Read an article years ago, and they were talking about how that area is not going to slow down till 2060. And so we will all probably be out of this working world game by that point. But it's interesting that that business isn't going to slow down until 2060. Okay, questions, anybody?
No, I wanted to kick us off with the questions in terms of, I know that, you did a beautiful job of just giving a general overview. I'm curious for anybody that's joining today or will watch the recording in terms of specific hiring trends outside of the nursing shortage and the doctor shortage. Like, what are the other hiring trends that you're seeing that people can start to think about?
That's an interesting question. For the work that we did, we do 95% of our work with private equity backed orgs. So they don't seem to, hiring in those orgs don't really seem to be slowing down as far as their scaling. I think it's more of areas within healthcare. As far as if you're looking for a job, there's definitely areas that are, need more help. The home healthcare areas, we don't really do work with providers, not that we wouldn't, but yeah, I guess to answer your question, I'll be so circular about it. It really depends on the area. For example, if you want a job in an AI healthcare specific company these days, you have there's going to be more jobs there than say in urgent cares.
So two quick questions for those that are on here, and again that will listen to the recording, and they want to reach out to you, they want to learn more about the work that you do. What's the best way for them to get in touch with you? LinkedIn,
obviously as being a recruiter, I'm on LinkedIn a fair amount. And it's always nice to start out a conversation with somebody knowing their background.
Great. And then from a recruiting perspective, what advice do you have for anyone who is trying to get recruited or is interested in specifically working with you and your company?
No, sure. Always happy to talk about that. And to that point, with Teamworks, we work with our clients. We're not a staffing company, if you will. So we go out and, literally search for people based on the, parameters and the wants and needs of our clients. So it's pretty specific type of stuff. But, I would definitely recommend, reaching out directly to people that you think are hiring managers on LinkedIn. Within the companies that you're interested. Have a good, it's not really an elevator pitch, but think about what your ideal position would be. It's not about a job title. It's about, what are the tasks and responsibilities that you really enjoy doing that you can bring to the table for an employer? Because, if you get into a position where those are your main tasks and responsibilities, one, you're going to enjoy what you do every day more, but two, you're going to be better at it because people are good at things they like to do and they're not good at things they don't like to do. But reaching out directly to who you think will be a decision maker and sending them a connection request, I definitely recommend that. And just tell them you're interested in the company and that sort of thing. And that way, even if they don't have jobs online, and whether there is a job that you see out there where really 90% of jobs you never see online, only about 10% are really ever advertised. They hire people like myself for the other 90%. But to that, what it comes down to is you got a leg up if when you're showing interest and some drive, but also if you can save them some money, whether in their internal manpower costs with their recruiters or saving money on the outside recruitment side, like with me.
That makes a lot of sense. We have another question in the chat. So how do people obtain access to the PwC or McKinsey research databases that you've referenced?
Oh, totally just Googling it. Google like healthcare trends, you'll see the PwC one. There's a fair amount of what I put into this. That's in the one for 2023. But yeah, those are really great. I mean, so, obviously we're not quite halfway through the year at this point, but come usually September, October, they all publish their new ones. So you'll see the, trends for 2024.
Okay, very nice. And I would say, just kind of wrapping up our time together, you threw a lot of really great information at us today, which I appreciate. Kind of what are your key takeaways? What do you want people to really kind of leave this conversation knowing and thinking about?
Yeah, I mean, one, if you're, interested in this chat, I mean, healthcare is not a bad way to go. I mean, I'm a bit prejudiced in what I do for a living, as far as preferring healthcare within other industries, but no industry is recession proof, but healthcare is pretty close. And especially depending on what you're looking to do. I mean, shoot, if you want to go be a nurse, you got to go to school, but you're going to be able to get a job pretty much immediately as soon as you get out. So I know it's also, being in healthcare is it's a gratifying industry to be in. I always say to people, my father's actually a retired urologist surgeon, and I say, well, I knew I was never going to be a doctor when I was the dumbest kid in AP Chem in high school. But with that, when Jeff, my partner, and I say, I mean, but we can still bring up healthcare with what we do, and anybody can bring up healthcare in any position that they're in once they get into the industry. So yeah, go healthcare. That's what I would say.
All right. So with that, if you look in the chat, you can reference Noah's LinkedIn, and feel free to reach out to him through that. Noah, thank you again for your time. I always learn a lot when you jump on these. And with that, everybody enjoy the rest of your day. And thanks again for coming.
Thank you, everyone.